All right, day 2. It's about 4 a.m. in the morning, somewhere up there. Um, the reason I'm up is I get up every 2 hours for some reason. And of course, they're coming in to do vitals and ask if I need any pain medication. So far, I don't remember when the last time was I got pain medication, but I didn't need it this time. Maybe I took it last time. They gave some hydrocodone, and I had to have some Malox. Um, I don't have any eye drops for my eyes. They get dry every once in a while. They just use some saline for that. Other than that, I got breakfast ordered. Don't forget about your breakfast. Things are moving around in the gut. They're still in the gut, but at least they're moving around. So hopefully I won't get the constipation and things will be fine. That would suck having that with a back injury like this. Yeah, I figured out why it was so cold the other night. The temperature was set down to 60 degrees. Ugh. I had to move that up, but don't have them move your temperature up too much because then you get hot. And there's nothing worse, it really seems, in being hot and uncomfortable and not able to move. So just take it easy. I only had them put it up to 72, but I still woke up warm one time. About the third wake ago, I guess. So, anyways, that's it. I'm able to talk. As long as I stay in one place, I don't have any pain. My goal is, again, to be able to stand up without feeling nauseous. Did a little bit better just now, but still a little bit in there. But that's my goal. We'll see how I do. I'll keep trying. All right, so it's about 7 a.m. Day 2. Didn't get any medicine 2 hours ago. She comes in about every 2 hours on the hour, like at 12, 2, 4, 6. So I went without medicine on the one for 4 a.m. Mainly because I was feeling okay, but I'm still apprehensive on doing that because I don't want it to wear off and then have to wait for it to kick in. But it was all right. I called her back about 5 and had them bring the medicine. They brought it at 6. So hydrocodone, 1 pill of that. And she was asking me if I need 1 pill or 2 pill, but hydrocodone on its own that I was prescribed years ago, if I took 2 pills, that would just make me sick. Ain't nothing worse than being sick and having dry heaves with the pain that's in the back. Also some sort of muscle relaxer, Regulathom. I don't remember what the name of it is. I'm sorry. I'll see if I can get that just so you've got for comparison what I'm taking. If I'm in a good spot, there's really no pain. And a good spot being laying down flat or on my side. And as soon as everything settles down and I'm flat and I let go of all my muscle that I'm trying to hold in, then it's not that bad. Really, Or it hasn't been, let's say that. It hasn't been that bad. So hopefully it'll continue. The doctor came in. He said there was a lot of disc in one area that he had to pull out. Was checking my legs, feeling things like that. I hadn't talked about it before, but I have at least one bad bulging disc that was causing most of my pain, and I've had it for 28 some odd years. It's just gotten worse and worse and worse, and this, we'll see. Hopefully this surgery will allow me to move around a little bit more, allow me to want to be able to move around and go out and do things. When you got back pain, the biggest thing you're doing when deciding what you're going to do is how much pain it's going to cause. And is there any trade-off? You know, is where I'm going to be worth the pain I'm going to be in? And sometimes, you know, no matter how good the reward on the other side, sometimes it's just not worth the pain. So hopefully this is going to make it better for at least 10 years. Hopefully more, but at least the next 10 years. So we'll see. And I'll do another video when I can. I'm just waiting on breakfast. All right, I've been talking for about 5 minutes or so and realized I didn't have video running. It's 9:50 day 2, 9:50 a.m. day 2. They just gave me a shot of Demerol. I did a little bit of walking on my own. PT had been in earlier, but I was eating, so I figured I'd get a head start on it. I'm okay to walk. I mean, it's sore, but I'm used to walking sore anyways. Just not for very long. But I went out the hall, around the corner to the end and back again. Nurse thought it was good enough. She's giving me a shot of Demerol, and then at some point here, 2 of the hydrocodones. Let's see if I can take that without getting sick. I'm apprehensive about it, but we'll see. But that's all that's going on right now. French toast and scrambled eggs for breakfast. Sweet tea is really sweet, but tasted good. Other than that, I'm going to try to get some sleep. All right, shutting down. All right, so it's second day and about 10 minutes to 5 p.m. These last 2 days seem to be in a time loop. It feels more like 11 or 12 p.m., you know, late at night. Maybe it's because this room don't have any windows on it. But every time I go for a nap or close my eyes, it's only for about an hour rather than a couple 2 or 4 hours at a time. They came in and gave me some more medicine. So I'm on 2 hydrocodones, and I don't know how they measure the amounts and things like that when you're mixing it with with Tylenol, but I was able to take 2 of them without getting nauseous, and I don't know that it really helps a lot. We'll see as we go on, but so far so good. I went out and did a walk around the block, inside of course. without a walker. Seems, my stability and everything is there, so we'll just keep fingers crossed and see how it goes.